What is gout? Gout is a painful form of arthritis caused by uric acid crystals that form in and around the joints. It's the most common type of inflammatory arthritis. It's more common in men and you're more likely to get it as you get older. What are the symptoms? Symptoms of gout aren't usually noticeable unless you are having an attack of gout. Attacks of gout usually last between 5 and 7 days, where you will experience symptoms. What causes gout? There are two different types of gout. When you have it and there's no single cause, it's called primary gout. When you have it and it's caused by something else, it's known as secondary gout. Secondary gout can be caused by either chronic kidney disease, long-term use of medications that affect how well your kidneys can remove urate from your body. Risk factors. There are a number of things which can increase your risk of developing gout. Family history. Even though your kidneys can be completely healthy, sometimes the genes you've inherited make it more likely that your kidneys don't flush urate out as well as they should. This is the most common cause of primary gout, especially when several family members are affected, such as your parents or grandparents. Being overweight. Gout is much more common in people who are overweight. The more overweight you are, the more urate your body produces. Your body may produce more urate than your kidneys can cope with. Being overweight also makes it more likely that you'll have high blood pressure, type 2 diabetes, high cholesterol, fats in your blood. These conditions can all lower how much urate is filtered out by your kidneys. Gender and age. Gout is about 4 times more common in men than women. It can affect men of any age, but the risk is greater as you get older. Women rarely develop gout before the menopause. This is because the female hormone estrogen increases how much urate is filtered out by the kidneys. But after the menopause, estrogen levels go down and urate levels go up. The menopause is a natural part of aging, and usually happens in women aged between 45 and 55. It's when a woman stops having periods and is no longer able to get pregnant naturally. Find out more about the menopause. Taking certain medications. These include diuretics, also known as water tablets, and several tablets for high blood pressure, including beta blockers and ACE inhibitors. If you are on these, you should speak to your doctor about the risks if you are concerned. Other conditions. Several different conditions are linked to raised urate levels. This could be because they affect the way the kidneys filter urate, or because they cause more urate to be produced in the first place. For some conditions, the link with gout is less clear and may be due to many different factors. Common conditions associated with gout include chronic kidney disease, high cholesterol and fats in the blood, high blood pressure, type 2 diabetes, osteoarthritis. What can trigger an attack? Several things can cause the crystals to shake loose into your joint cavity, triggering an attack. These include a knock or injury to the joint, an illness that gives you a fever, having an operation, having an unusually large meal, especially a fatty meal, drinking too much alcohol, dehydration, starting urate-lowering therapy, ULT, especially at a high dose, or not taking your ULT regularly each day. Diagnosis. Diagnosing gout is usually straightforward, especially if you have typical symptoms of the condition. For example, if you have an attack in your big toe. But gout can sometimes be more difficult to diagnose. Your doctor will need to know about the symptoms you've been having and will probably need to do some tests. Blood tests. Blood tests to measure your urate levels can be helpful to support a diagnosis of gout. But they aren't enough to confirm it on their own. High urate levels in blood tests can suggest that you have gout. But this will need to be considered alongside your symptoms. It's possible to have high levels of urate, but not have any other symptoms of the condition. Scans. Ultrasound and CT scans can be good at spotting joint damage, crystals in the joints and early signs of gout. X-rays are generally used to pick up the bone and joint damage caused by having gout for a long time. Synovial fluid test. This is a good way to confirm the diagnosis and rule out other causes. This examination is done by taking a sample of your synovial fluid. Synovial fluid is made inside the capsules of some joints. It helps to nourish and lubricate the joints. This is done by inserting a needle into one of your joints. The fluid is then examined under a microscope for urate crystals. If you have TOFI, doctors can take a sample from one of those instead. Treatments. Treatments for gout can be very successful. There are two main parts to treating gout, which include treating the acute attack, treatments to prevent future attacks. Treating a gout attack. Treating an attack of gout doesn't lower your urate levels or stop future attacks. The treatment helps you to manage your symptoms when an attack happens. The most common drug treatments for attacks of gout are non-steroidal anti-inflammatory drugs, NSAIDs, steroids, colchicine. Some people will be better suited to NSAIDs, while for others NSAIDs cannot be used. But your preference is also taken into consideration. Many people with gout quickly learn what works best for them. In cases where one drug doesn't seem to be working on its own, your doctor might suggest a combination of NSAIDs with either colchicine or steroids. Non-steroidal anti-inflammatory drugs, NSAIDs. Attacks of gout are often treated with NSAID tablets, which can help with pain and reduce some of your inflammation. Naproxen, diclofenac, and etoposide are 3 NSAIDs you could be given. If you've been prescribed NSAIDs to treat an attack, you should start taking them as soon as you notice signs of one coming on. Your doctor may let you keep a supply so you can start taking them at the first signs of an attack. The earlier you start treatment, the better. NSAIDs aren't suitable for everyone, so talk to your doctor about them first if you have any other conditions. They can also interact with other drugs, so make sure you talk to a doctor before starting on any new medication. NSAIDs aren't usually prescribed for a long period of time, as they can cause problems with your digestive system. To reduce the risk of this happening and to protect your stomach, your doctor will also prescribe a proton pump inhibitor. Colchicine. Colchicine isn't a painkiller, but can be very effective at reducing the inflammation caused by urate crystals. As with NSAIDs, colchicine tablets should be taken as soon as you notice an attack coming on, or it may not work as well. Your doctor will probably recommend keeping a supply at home. Colchicine can interact with several other drugs, including statins taken for high cholesterol. Colchicine tablets can cause diarrhea or stomach aches. Steroids. Steroids are very useful for acute attacks of gout. They are usually taken as a short course of tablets, lasting a few days. However, they can also be taken as an injection into a muscle or joint affected by gout. This can be particularly helpful if gout is affecting only one joint. At the end, it is requested to please subscribe us.